are these people?
So this article is from Reason, written by Liz Wolfe. And she reports that 40% of DC's Black teens will soon be barred from school because they aren't vaccinated. Muriel Bowser and the DC Council will force all public school students ages 12 and up to be vaccinated against COVID-19. So according to a report, school started for us on Monday for District Columbia Public Schools, which is requiring, per DC Council vote, that all students ages 12 and up be vaccinated against COVID-19. In addition to teens providing proof of vaccination, students of all ages must provide proof of a negative COVID test prior to the first day of school. So actually, I did this today, well, yesterday for my kids, and we've had this since the beginning of the year where at certain points of the year, there's a test to return. So basically, students have to take, in my case, because I teach pre-K, students have to take a rapid test the day before they start school. And they must have a negative test in order for them to come to school.
Right.
Do you know what they did last year? What did they do last year?
We did do it last year, at least
It's the same exact thing.
well, at least for my kids, because at the time they couldn't get vaccinated. We had to do a test return every week. So we send rapid tests home with them on Friday. They took it over the weekend. If they had a negative test, they will come back on Monday. Or if we have like a long break, we would test before we return from like a long, like a vacation break or something like that.
Okay.
Okay, so to continue, we're not offering remote learning for children, and families will need to comply with what is necessary to come to school, said Democratic Mayor Muriel Bowser in a press briefing. Though students will be allowed limited medical and religious exemptions from vaccine requirements, a significant chunk of the district's teens remain unvaccinated, per current data. That number is significantly higher for Black teens. Through 87% of DC's white teens between the ages of 12 and 15 are vaccinated, only 53% of DC's Black teens are. For the next age group up, comprising of 16 and 17-year-olds, 89% of white teens are fully vaccinated, whereas only 58% of Black teens are. In many other contexts, a city policy having such a racially disparate impact would be cause for concern, particularly for progressives who frequently measure and seek to remedy such impacts. In this context, Bowser and DC Council members appear to be less concerned that these restrictive policies might lead to a disproportionate increase in truancy, which could result in parents being harassed and monitored by DC's Child and Family Services Agency, or even in extreme cases, locked up and forced to pay fines, reportedly out of state concern for the good of the children. Both DC Health and Bowser have been explicit about the fact that unexcused absences due to lack of immunization may lead not to just the schools routinely contacting the parent, guardian, or adult student, placing phone calls, sending written notices to the home, referring students to student support teams, but also may include making referrals to the CFCA, the Child Support Services Division, and the Office of Attorney General for truancy or educational neglect.
Okay. You need me to do this so that you can see, right? There you go.
Yeah, thank you. Public schools have long mandated certain vaccines for attendees, like those that protect against measles, polio, and pertussis. DC Health has noted that even routine vaccination rates, especially for poor and minority kids, have been lagging, possibly an unintended consequence of COVID lockdowns and people skipping medical checkups. But it's strange to add COVID vaccines to the list, given that the virus itself is not nearly as serious as measles or polio, and given that these vaccines have only recently been approved for kids.
Right.
Though there are practical reasons to want teens to be vaccinated, like preventing class-wide outbreaks that might lead to lots of absences, COVID vaccines do a very imperfect job of preventing breakthrough infections. They're invaluable primarily for preventing severe illness and death, which already occur infrequently for teens and kids. Given this, city authorities could reasonably recommend that kids get vaccinated prior to attending public school, as many school districts have. But they have instead chosen to mandate it, which is out of step with the choices of most other school districts in the nation. This is par for the course for some of the municipalities filled with the most insistent COVID hawks. This week, Bay Area school authorities called the cops on an unmasked 4-year-old and his father in an attempt to get them to leave school premises for masking violations. Similarly, Los Angeles County's public health boss, Barbara Ferrer, toyed last month with the idea of reintroducing mask mandates for residents before being met with threats of insubordination from residents of Beverly Hills. Ferrer scrapped her plans. Authorities should not in general create laws or policies they're not comfortable enforcing. It's therefore quite astonishing that 30 months into this pandemic, Bowser thinks COVID vaccination is so important to mandate that it would be worth an increase in the number of minority parents investigated or possibly locked up for their kids' truancy. But it seems like a horribly costly punishment for a debatable crime of a questionable public health merit, not to mention a host of civil liberties issues raised by mandating proof of COVID vaccination. DC officials should think long and hard about whether it's worth it. So there's an update. DC's Deputy Mayor of Education, Paul Kiln, said this afternoon that enforcement of the COVID-19 vaccine mandate has been pushed back to January 3rd, 2023.
You brought this, right? From the Intelligencer, Crab.
It's more. I'm tossing in like a bunch of links.
Yeah.
And especially, and this is like especially the case with Moderna. They're openly talking about this in public now. It's not like it's like the science.org one is probably the most reputable. But
which is the first one, BBC.
Yeah, these are on mainstream outlets now. Roughly 1 in 6,000 men aged 16 to 24 are going to get myocarditis.
Right.
That's what the science says, and now they're talking about it in public. It infuriates me how people just don't fucking read. They just don't bother to, like, we live in a time where we're able to just completely ignore relative information as if it doesn't benefit our narrative. If it doesn't benefit our narrative, then we just toss it in the garbage. But this is mainstream outlets. This is not like some pseudoscience shit. This is like real. This is actually happening. And we have politicians who are unbelievably uninformed and just make these wild policies that don't make any sense whatsoever.
Right. Well, trust
the science. Trust the science.
Right. I find it interesting though that, Mayor Bowser, I mean, we're talking about DeSantis, who is a Republican, who's doing a lot of crazy shit in your state, Reef. But this is a Democrat mayor who is insisting on this, which, given, low income communities are already kind of at risk for a lot of shit. And I think especially in regards to COVID. And then the idea, especially since lockdowns, people have not been able to necessarily go to the doctor as regularly as they probably should have, and then definitely with low income, you have, more of a risk of, not having health insurance. So you may not be able to go to the doctor when you need to, So the idea that Bowser is insisting to mandate teenagers in the district to have COVID vaccines when it's been proven to be a very leaky one, whereas officials, and that's kind of at least for me in elementary school in DC, like it's recommended that students get the COVID vaccine now that is available, to kids younger than 5 now. But the idea that she's mandating this, I think is especially heinous. Note that and I think I said this to you guys before we went live, initially the cutoff before students were not could not come to school was, I believe, October 15th. It's now been pushed back to January 3rd. And I think you can probably guess why she decided to do that.
Because it benefits a certain narrative. Like
it benefits her. It benefits her like election.
Yep.
Yeah, I'm
So
not even
she's
saying that there's like
Yeah.
there's like some like conspiratorial agenda going on. It's literally just because it feeds into whatever the current thing is right now.
Yeah.
And besides the point that it's a leaky vaccine, that this age group that we're talking about here has such relatively low risk that we're talking like flu levels.
Mm-hmm.
And to me, I mean, I know that it's like
than flu levels
we're kind of
in some
like beating a
cases.
dead horse at this point by saying like, oh, why? What's the point of mandating this shit? But really, like, what's the point of what is the point of these draconian measures that are just gonna, in the end, killing people? Really,
Yeah.
giving innocent young men heart issues. I mean, really, again, like, and the fact that here it shows that the majority of black kids are the ones who are being unvaccinated. We're testing grounds for whatever next big pharma push they want to have.
right. You know, I've been saying this, you know, for a while, but I think, you know, my dad, you know, like he's older and he has cancer, so he's prone to blood clots. So he didn't take the vaccine, but he wasn't going to take it anyway, given the his history, you know, as far as basically Black people basically being treated like guinea pigs for certain vaccines that people claimed to be healthy or necessary. And
like in this case, you got, they're gonna call truancy, like they're gonna call child protected service, like
it's
for
insane.
not being vaccinated. That's ridiculous.
I live right next to a pharmacy, and every day I walk to work. I walk to the train to get to work. I see like it's nearly on a daily basis. Like I see like elementary level school kids like lining up with their parents to go get vaccinated or to go get boosted. People are fucking insane. They don't give a shit. They just don't care. It
I don't think
breaks
it's
my
a matter.
heart. It
I don't think
honestly
it's a
breaks
matter of
my
not
fucking
giving a
heart.
shit. I think that's just what we've kind of been force fed at this point in the means of like trying to return to normal, quote unquote, whatever that is now. You know, and I think people are
What
just
kind of
using
normal is
this.
this? What is this normal? I don't understand.
No, I don't know, but
Yeah.
but it worked. So, I